Today we have a very special episode. This is actually the first time we have a podiatrist on the show, and there are only two podiatrists in Kuwait, and this is Mr. Richard. It's really nice to meet you, first of all.
Thanks a lot. Thanks a lot for inviting me.
Well, we're going to talk about the feet, and especially in diabetic patients, because we walk around on our feet all day. They carry a heavy load, and often people do forget about them, which is very sad. And I know that diabetic patients should not forget to care for their feet. So what are the common problems does a diabetic patient face concerning their feet, of course?
Okay. I think to answer that question, let's start with the scenario of a healthy foot.
Okay.
What happens if you injure your foot?
Mm-hmm.
You feel pain.
Absolutely.
Okay? And the area hurts.
Yeah.
Okay. And what happens next? You react.
Mm-hmm.
You either react by moving away from the stimuli,
Okay.
or by taking care of the part that's injured.
Okay.
You clean it. Okay. You dress it with antiseptic and to make sure that it heals. And at the same time, the blood is supplying the germ-fighting cells to an area,
Mm-hmm.
and the tissue-repairing cells to an area to start the healing process.
Okay. So this is what happens in the healthy foot. What about the diabetic foot? What happens there?
Okay. Now, I was still trying to explain to you what happens in the healthy foot, right? You feel pain because you have the nerves that are giving you
so
that
you remove
signal.
your foot or you do something. Yeah,
Right. Perfect.
absolutely.
And then you have good blood supply.
Mm-hmm.
That is why the blood is able to supply the area with the germ-fighting cells.
So it closes the wound
to
very
start the healing process.
healing
All right.
process. Yeah.
Now, if you have diabetes,
Mm-hmm.
if there's too much sugar in your blood, you have two problems.
Okay.
The first one is your sensation is diminished.
Okay.
So your nerves are a little bit affected.
Okay, they're not as good as the healthy.
They are not as good as the
person.
healthy. So
Yeah.
you may not be able to feel the pain that a normal person would feel.
Okay.
And number two, your blood vessels starts to harden.
Okay.
We call it normally vasculopathy.
Okay.
But this is hardening and the narrowing of the blood vessels. So very less blood goes onto an area. So you end up with a foot with an injury that is unable.
So you're saying that the diabetic foot has two problems basically. So there is a problem where there's not enough vessels or not enough blood going into the foot, and the other problem is that the nerves are damaged from the sugar.
Correct.
So okay.
So you are unable to respond properly
Okay.
to an injury.
Mm-hmm.
Okay. Now, the problem is if you can't feel pain,
Mm-hmm.
you may have an injury on your foot without
You won't even know it. Yeah.
without being aware that there's
Yeah.
an injury. Okay.
Okay.
And because you have less blood, that area may not be able to heal normally or as quick as it
So
would heal.
first of all,
in a
you
person.
won't feel the pain.
Yes.
So you can't actually withdraw your foot or actually see it after you're hurt.
Yes, yes.
And plus, you said that the healing process is much, much slower.
Correct.
And sometimes it doesn't heal even.
Yeah.
Okay.
And again, if you can't see the wound or if you can't see the injury, you won't be able to take care of the area. to
Exactly.
start dressing
Exactly.
it.
We'll totally forget about it. And plus, the feet are absolutely forgotten. Even we healthy people we just forget to check our foot all the time. Tell me about the problems of the foot again. So what are the diseases that can happen from this problem of, the blood supply and the nerves? What happens really?
Once you cannot feel on your feet,
Mm-hmm.
you have what you call peripheral neuropathy.
Okay.
So your sensation is diminished, and the signs and symptoms of that are a patient may complain of a burning sensation,
I get
or
it.
a cold sensation,
Okay.
or a pins and needle type of electric sharp shooting pain.
Yeah.
Sometimes the foot is numb, completely dead, and they often refer to it as a woody sensation.
Yeah,
It
yeah.
feels heavy.
It feels heavy.
Yeah.
Mm.
Now the problem with that is that if you can't feel pain, you're going to injure yourself,
Mhm.
and you leave injury unattended, it may lead to infection, and we know it will ultimately lead to amputation.
And we don't want that.
And
we
we
don't
don't
want
want
that.
that.
Absolutely.
Right. And secondly, if you don't have enough blood supply to your feet, you injure yourself, you need blood to heal the area.
Mhm.
And if you don't have enough blood, you are going to develop an ulcer, and it will take a long time to heal, and if there's infection again, it may lead to amputation.
Okay.
So those two are the most important problems that people with uncontrolled diabetes they face.
Okay, so in order for the diabetic patient not to lose a foot, they should of course take care of them and pay special care of the foot and even between the toes. So can you just tell me, go through how often should a diabetic patient actually see a doctor for the foot?
Let's start talking about how a diabetic patient can examine his feet or her feet to make sure that he prevents some problems that may occur later. Okay.
So what should
the
they
most
do?
important thing is they should look and examine their feet regularly.
Okay.
They look for any color changes. They look in between the toes. Okay. I can.
Yeah, please show me.
At last.
So you're going now to demonstrate how
I'm going to demonstrate how must a patient
a diabetic check his foot, which is very important.
Definitely. Okay.
So you need to have your gloves on first of all, of course.
Yes, yeah, of course. All right. So they need to examine their feet all around, on top and at the bottom. If they are unable to look at the bottom, they can ask somebody, a helper, to look at the bottom, or they can even use a mirror to be able to look at the bottom.
Yeah.
Okay. Check for any cuts, for any bruising. You check in between the toes individually. You look for any discoloration.
Yeah.
Okay. Because fungal infection likes hiding in all these areas.
Yeah,
right?
they do love humid areas.
Absolutely. And you look underneath the feet and also at the bottom of your feet as well. Okay. That's very important.
And of course, you mentioned something about the hair. So because he has, notice the areas of hair in your foot.
The hair is the best telltale sign of good blood supply.
Yeah.
Once you have hair and other people don't have hair, of course, if you know that you have hair and it's starting to wear off, then you know that you
have problems, which is a really good tip, I think.
All right. Okay. And you have to examine your shoes. Okay.
Okay.
You have to wear. Can I look at your shoes? Okay.
So, let's see the shoes. Of course, they're not the nicest shoes, but
all right. The shoes have to have enough space for your toes. Okay. And we often say that your toes should be able to wiggle when you are wearing your shoe.
Okay.
And it should have enough supportive heel counter. This area should not be a high heel shoe. Okay. And it should be made of leather material because leather is breathable.
So why is this a good shoe?
I think this is a good shoe, although it lacks a little bit of support around the heel counter.
So you need support. You need something hard.
You need good support around the heel counter.
And you need a round, I think, shape in the front.
I think the toe box, we call this area a toe box, is sufficient. Yeah? However, the sole is not enough to cushion the foot as well.
Okay, so you need a good cushiony sole. Okay.
And for diabetics, we often recommend shoes with laces or with Velcro so that you can always adjust the width of your
shoes with something to tie. It's better to tie your shoes. Better than this type of shoe. Okay, that's really nice. So tell me, what should the diabetic patient do to care for their foot? I'm sure there are ways that you can keep your foot very nice and clean.
I think that's a good question. Yeah, that's a good question that you are asking there. They should be able to examine their feet regularly. Okay. They should be able to wash.
Like every night?
At least twice a day.
At least twice a day to check their foot?
At least twice a day to check their feet.
Okay. So it's very frequent, yeah.
They should be able to wash their feet at least twice a day.
Okay.
Because you get other people who rarely wash their feet.
Yeah.
And as you wash your feet, you'll be able to examine your feet to make sure. Is it with
soap or just with water?
With a very mild soap, of course, and a warm water.
Warm water.
If your doctor has already diagnosed you with a peripheral neuropathy or nerves that are no longer normal, you have to use a thermometer to test the water, or you ask somebody who's got good sensation to test the water for yourself. Yeah. Otherwise, you can end up burning yourself. You have to examine your shoes regularly before you wear your shoes, especially again if you have neuropathy.
And should they wear socks, of course,
with a shoe? You have to wear 100% cotton socks because they can absorb moisture.
Okay.
And they have to alternate their socks, of course. They cannot wear one socks over and over again. Okay.
What about the nails? How should they cut the nails?
Yes. They should cut their nails straight across, not too short. Okay, you cut the nails straight across, and you can get a file to file the edges. That's all you do. You never cut on the edges because
So,
then you can end up
you
with...
mean if we have a nail, so just cut it?
Yes, if you have a nail
straight.
like this, you just cut it straight. Okay?
Yeah.
Not too short because you're gonna bleed yourself.
Okay,
And then
yeah.
you take a file. Most pharmacies they have the file, and you just file the edges very gently.
Very
Never
gently.
cut on the edges like that.
Never
because
cut
you
the edges.
may end
Okay.
up with a nail splinter.
Yeah.
That may cause an ingrowing toenail.
And this is the thing, because usually people don't know about nail care, and for example, even females, they tend to go to the pedicure.
Pedicure, yes.
And I think it's an issue. What do you think?
This is an issue. If you are diabetic and you have peripheral neuropathy or you have an arterial disease that we mentioned earlier, you should not go there, because what the pedicurists normally do, they poke the edges
They
of the
do,
nail,
and it
it bleeds,
bothers
and we
me
end
as
up
well.
getting some infection, because
Yeah.
you're gonna go into a shower and take a bath in that, and then you're gonna end up with an infection.
And we don't want that, of
And
course.
we don't want that.
So what about in the clinic? How often should they go see their doctor about their feet?
Right. If you go to your clinic, if you go to see your doctor will examine your feet and will be able to classify whether you are a high risk or a low risk.
Okay.
If you are a low risk, you can see your doctor annually, once a
Okay,
year.
I get it. Yeah.
However, if you are a high risk, for instance, if you have peripheral neuropathy or you have an arterial disease, you have to see your doctor regularly, and ideally 2 to 3 months.
Okay. And in the doctor's office, what would the doctor do to examine the foot?
Okay. When you come to the doctor's office, we assess basic things. And the first one is we have to assess your circulation. And to assess circulation, we can use our hands to palpate the pulses on your feet. And there are 2 major pulses that we find. The ones that you find here, we call them dorsalis pedis. And again, the ones that you find there on the inner part of the feet, and we call posterior tibialis. However, some doctors, they have a Doppler, which is more accurate than just palpating with your fingers.
That's
the Doppler
really
will
good.
be able to tell us whether you have a arterial disease or not.
That's
using a
really good.
Doppler.
Yeah.
Okay. And we've already mentioned that the presence of the hair tells us that you've got good blood supply. Okay. And we also do what we call capillary refill time, and where you just blanch the edge part of the toe. You can even blanch on the nail itself.
Yeah.
And then the time it takes for blood to refill, it gives us an idea of whether you have a good blood supply or not.
That's really brilliant.
And then the temperature as well. Again, in the doctor's office, they may use the back of their hands just to feel, because you know that with good blood supply, your feet
It's
will
a
be
bit
warm.
warm,
Okay.
yeah.
And they will be able to tell if one is colder than the other one. And that can also alert them that there's something wrong or there's a blockage on the other foot. And other doctors also, they use we call this a thermoflash. Okay. This is the thermometer. Okay. We use it to check the temperature. Okay. You don't have to touch the skin, and for infection control, and this will be able to tell you if there's any differences in temperature. So you will be able to check on different areas, okay, and it will give you the reading.
That's amazing. So now we want some advice for people who are going to Umrah. You know, in Umrah, the people go for pilgrimages, as it's like pilgrimage, and in Ramadan they go and they walk a really long distance. So do you have any advice for people going to Umrah to care for their feet?
Yes. People going to Umrah to care for their feet, as long as they are not high risk, we don't have the problem. However, if you are a high risk patient, and remember what you are trying to prevent here is ulcer formation,
Yes.
because we know that with an ulcer that can lead to amputation as well. So we often, if possible, advise them that they have to wear shoes, they have to wear protective footwear to prevent themselves the injuries on their feet.
So do you recommend, for example, moisturizing their feet all the time?
Absolutely, yes. They have to moisturize, especially if they have neuropathy. Sometimes their feet becomes too dry, so they have to regularly moisturize their feet to make sure that they replenish the oils that are lost on their feet.
That's brilliant advice. Thank you so much for giving us this advice, and I'm sure every diabetic does need all this information. And if you have a diabetic at home, make sure they go to their podiatrist regularly. Thank you so much for being here.
It's my pleasure. Thanks for inviting me.
And thank you so much, guys, for watching us. See you in another episode.